Ngri Nangi, everyone. Nana Waimichi Paul Worley, Napi Puteri Māori Pomerapunk, Nana Jerry Rui. G'day and welcome to this race grand round. My name's Paul Worley, coming to you from Nunnerjerry country, Murray Bridges, where I work. And it's a great privilege to be able to speak in the language of people who have been living and working and breathing healthcare in our region for over 60,000 years. And today we've got the privilege of recognising excellence and expertise that's in our state, particularly in the Wardliparingga Centre for Aboriginal Health Equity, that's part of SAMRI, and it's a great pleasure to be able to welcome Kim Morey and Odette Pearson as the co-theme leaders for that theme, and to hear the work that they're doing. Of course, health equity is very important to RMC, but they are words that sometimes get used more than acted on. So I'm looking forward to hearing what Kim and Odette can bring to us, what we can learn, and how we might be able to go forward and work together. Welcome, Kim. Welcome, Odette, and look forward to hearing from you.
Thanks very much, Paul. Thank you for having us. So, Nainari, Kim, Katanya, Naparula, Morey. So my name is Kim Morey. I'm the firstborn daughter in my family. I'm an Arunda Mudgeta person, but I've grown up here on Kaurna Yatta.
Nainari Odette Pearson. I'm Torres Strait Islander from Errab Island and Eastern Yalanji from the Daintree area in North Queensland. And I've had the privilege of living and working on Kaurna land now for 17 years. And I'm co-theme lead here with Kim of the research unit.
We'd obviously also like to acknowledge and pay our respects to the ancestors of the people of the lands that we're meeting on, so obviously the Kaurna peoples, but we also want to acknowledge the Nunnerjerry Nation and the Nunnerjerry elders and ancestors of the lands that you are located on. We pay our ongoing respects to the elders. We acknowledge the ongoing connection and special connection to the country and seas and lands and waters and rivers of the traditional owners. And if there are other Aboriginal and Torres Strait Islander people online, we'd also like to pay our respects to your ancestors and also acknowledge you and your elders as well. Just to, as a cultural sensitivity warning, there may be images of people that have passed away in this presentation. So as a cultural protocol, we'd just like to give that warning up front.
So with the presentation today, thank you for inviting us to talk at the Grand Round. We'll just briefly cover SAMRI. I'm sure by now people know a bit about SAMRI. And then we'll talk about the foundational work that we've been doing over the last, or that we did at the beginning of the decade since we've been established. And then some of the research that we're doing in relation to improving equity, particularly here within South Australia. So SAMRI, everyone would know where it's located, near the Royal Adelaide Hospital, endearingly called the cheese grater by many. We're a not-for-profit medical research institute. And we have the ability through our independence to be able to be agile in certain ways. We're obviously evidence-led and we like to be highly collaborative. We have several different, if you move to the next slide, just a bit of an insight into the way we organise ourselves within SAMRI at a very high level. So Aboriginal health equity has been a core theme of SAMRI from its very establishment. And this is something that is it is unique in the Research Institute environment across Australia and potentially even across the globe, where Aboriginal health or Indigenous health is actually a core theme, as opposed to, you know, running through different all the different streams, which is generally what you find. And there's obviously benefits to that. I think in South Australia it's been a great benefit, and we'll talk you'll start to see that as we talk further about the research. But then there's also, you know, things that we need to do purposefully to ensure that we're also working and collaborating across each of the themes, which we think we've been able to achieve coming into the next decade, sort of towards the end of this decade. So lifelong health, precision cancer medicine, SAMRI Women's and Kids, which also has an Aboriginal health program within it, which is a very strong health program. And then there's all of our sort of impact areas that you can see up there. Just a special mention with regards to SAMRI Women's and Kids. We in Wardliparingga cover from sort of adolescent health through to older people's, and we collaborate with SAMRI Women's and Kids in relation to mothers and babies and children. And that's because they have the content expertise as well as the technical expertise and the relationships in that space. So we started in 2012. 2000. SAMRI started in 2012. Our inaugural theme leader was Professor Alex Brown. Kim was the second person to be employed within the first 3 weeks. I was the third person of Aboriginal person. So we grew the theme together over the last decade. Alex left about 2.5 years ago, nearly 3 years ago now, and Kim and I have continued the work and grown the theme in different ways. So Wardliparingga, as Kim mentioned, was gifted to us. The name was gifted to us by the Kaurna Language Committee, and Wadley means house and Wadley means house or hut, and Paringa means river, and that's reflected in where we're located here on the banks of the Torres River. We organise ourselves in relation to population health, health services and systems, and implementation science. So these are the methodologies that we have expertise in across the theme. And as I said, we work and social and emotional wellbeing, so psychology or social sciences really. And we work from sort of adolescent health through to ageing. So most of our work is with South Australian communities or South Australian organisations. We partner with South Australian government, LHNs such as yourself, and over the decade we've done that in many different ways on many different projects. We also have a national focus, and we do a bit of international work, particularly in relation to diabetes. When Alex first arrived here, if you can remember back that far, a decade ago, the Aboriginal health research space or landscape was very, very different to what it is today. And there was Aboriginal health research being done by the 3 universities, and then SAMRI became established. And the first thing that we did was to hold a community meeting to hear from Aboriginal organisations, Aboriginal leaders, Aboriginal workforce, Aboriginal community members, their views on research and what were their priorities for research as well. So this piece of work is actually the first piece of research that we did, and it was with the Aboriginal Health Council of South Australia, and it was about determining community priorities for research. And so we did that through a series of qualitative research interviews with different Aboriginal community control organisations, as well as the health action groups at the time, which were the community groups overseeing the work of the health services. And we also did a retrospective audit of ethics AREC studies, AREC approved studies, or not approved studies actually, to form this document. And so really our program of research, it responds to the areas within this document, so the priorities that we have research expertise to lend to those priorities. We also heard really strongly that things needed to be done differently when it came to research. And by that, we all know, research was done to, we were the subjects of research, and that needed to change if we were actually going to be able to make a difference in the lives of Aboriginal peoples through research here in South Australia. And so from that, Kim and Arnie Chris Franks led the development of the Aboriginal Health Research Accord, and that has 9 principles that were outlined through consultations, through looking at international literature, through drawing on ethics, and this was signed by the Aboriginal Health Council of Australia, by the 3 universities. And you'll also see that SA Health was brought along on the journey as well.
Yeah. So we also did some work around developing up some Aboriginal and Torres Strait Islander protocols to support SAMRI as a new organisation and growing organisation, so that the rest of the themes and our colleagues were able to get some guidance around what were important considerations when undertaking or engaging with Aboriginal and Torres Strait Islander people in the research space. We've developed an Aboriginal and Torres Strait Islander workforce strategy, which is very ambitious and has lots of actions, which we are aiming to still work towards achieving. And then we also developed a reconciliation action plan, and we're about to relaunch a stretch reconciliation action plan, which has really been a strategic umbrella for us to be able to do a range of activities across the organisation and to really grow and enhance the rest of the organisation's capacity around our business. This is one of our first studies that we'd like to talk to you about. It's a large cohort study, and diabetes is obviously a significant health priority in our population. And so we did statewide consultation across South Australia to introduce Alex Brown to the community and to also, talk about what our priorities look like. And certainly diabetes was one of those that emerged. And so what this study is really trying to understand is, are there any biomarkers within our blood that could be identified to do 2 things? One, to slow down the progression of diabetes amongst our population, and to hopefully be able to understand how we can stop the progression of diabetes, but also the complications of diabetes. So, we know the complications have a very big impact on Aboriginal people's lives with, disproportionate rates of cardiovascular disease, diabetic retinopathy, diabetic foot complications, and all of those things that contribute to Aboriginal people's, quality of life. And so this is really trying to understand how can we stop the progression of those, and then also clinically, if we can identify those biomarkers and know when someone's diagnosed, what clinically can we do to support that person so they don't progress to having, complications in the future? So if we can find the answers to those questions, it won't just have a benefit for South Australian Aboriginal people, it potentially has a benefit to Aboriginal people nationally. And that's the work that Alex is now doing around the genetics and exploring the epigenetics, which is the next phase of work that Alex is leading now. Through the diabetes study, we also have been doing some other work around some of the complications. So that we've been working in an Aboriginal eye health project, which is a partnership with Flinders University, Southern LHN and Northern LHN. And it's really to improve the screening, detection and treatment rates for diabetic retinopathy. So in the diabetes study, we do a full health assessment. And so where we've identified, people that have required further support and follow-up, this study is also trying to improve those pathways into the system and ensure that Aboriginal people are getting that access to those screenings and detection and treatment in a timely manner. And so this is creating some really good evidence, and we're seeing translation happen as the study goes, which is a really great outcome. This next study is looking at improving the interface between when Aboriginal people have experienced a hospitalisation, particularly in the Royal Adelaide Hospital, for a complication of diabetes, either in the foot complication or in renal, or have had a heart attack or stroke. What the evidence tells us through the work that we've done developing chronic disease plans is that often our people will fall through the cracks when they're coming out of the hospital system. And so this is really aiming to support people to have an individualised plan, a multidisciplinary plan that has priorities determined by the individual, and then a really clear and good handover to a navigator in the community that then works with the Aboriginal family and across the system to implement that individualised plan. So we've been doing a co-design process for about 8 or 9 months. We're doing our protocol and ethics, and we're hoping to get this project operationalised next year. And we're starting to look at negotiations with particular areas around partnering and having those navigator roles in communities to support the increased implementation of those plans. We've been doing a lot of translational work in the diabetic foot space. So we do have we call it a National Diabetic Foot Complications Program, but it's really the T-bone of Australia. So we have funding in South Australia, Central Australia, the top end, into the Cairns region and the Kimberley region. But in South Australia, we've really been looking at trying to improve systems approaches. This is our second phase of funding. And we really work across 4 domains. So with community, we've been doing a lot of community promotion and engagement with the community around the understanding foot health, looking at systems approaches, trying to improve systems informing models of care, workforce training and development, and improving data. And through the feedback through our senior officers group members, which are all of the Aboriginal directors and executive directors through the local health networks, we've also been looking at improving amputation care pathways for Aboriginal people who experience an amputation, and also considering the cultural considerations if someone has had an amputation. And we've been doing some lived experience work with our community around some resource development to support people when they have an amputation.
Yeah, so that work has really been informed by the South Australian Aboriginal diabetes strategy that we developed back in 2015 through a very consultative I'd say like multi-pronged research approach. And one of the things that came through really strongly, as you would expect, was around the workforce and how important the primary healthcare workforce is in the management of type 2 diabetes, in slowing that disease progression, reducing preventable hospital admissions. So when we did audits across the state, we could see that there was a lot of variation in the way in which the guidelines were being delivered. And so we took the information coming through the consultations around supporting the workforce, building the capability of the workforce, as well as being informed through those audits and a series of systems assessments that we did to develop this program or this project, which was around developing a training program that bridged the gap between the Aboriginal Health Practitioner Certificate 4 or the Health Worker Certificate 3 and the Diabetes Educator study, which there was seen to be a gap in between. So we did a bit of work around that, and with the NDSS, the Australian Diabetes Educator Association, Diabetes Queensland and Diabetes Australia, we developed a set of modules that are available for free on the National Diabetes Services Scheme website, and several hundred clinicians around Australia have accessed those. We developed those with 7 different primary healthcare services here in South Australia. And Sharon's group was actually part of those consultations in the co-design of these modules. And now we're at the stage of actually delivering that program and evaluating the program to see, is it actually effective, and is it changing knowledge, practice, skill, attitude towards diabetes amongst the workforce, amongst the primary healthcare workforce. The COVID work we've just really started doing, and this was in response to conversations with the CEO at the CEO forum that of the membership of the Aboriginal Health Council of South Australia, where they had a series of questions around COVID. And one of the biggest concerns is around the workforce, the Aboriginal community-controlled health workforce, how that's been affected by COVID, how the community's been affected by COVID. So we're really just starting out. We've done 2 projects in the space, and this is the 3rd project where we were approached by a community organisation to answer some questions that they had that were particular to the area, to their sort of area of communities. And so that's probably the newest bit of our program of research. We actually won't take on sort of new research areas unless we're getting approached by community. And so this area, as well as our ageing area, which is now about 6 years old, are the two newest sort of focuses of research, really. And our ageing work, as I said, we've now been working in this space for about 6 years. We've worked with Aboriginal elders and older people themselves. We've worked with the State Aboriginal Community Services Organisation to answer questions of importance to them and to help refine their systems and their processes. And we're currently completing a workforce program that they're rolling out across their workforce. We co-designed that program for their workforce, and we'll be evaluating that in the next 6 months. That will come to an end. And all of that work has really accumulated and grown into and informed this more recent MRFF project, which is the Aboriginal Informed System Connector Model for Ageing Well. And this is in its 1st year. So we're really just designing, what does it take to actually ensure that older people are connected to, who are receiving aged care, are able to receive all of the social services as well as the health care that they require. Racism, so through our health systems work, racism has come out strongly over the last decade, and probably more so recently, being voiced in probably sort of the last 4 years. And so we do have a small program of work that's run through our social emotional wellbeing program that is looking at racism. Our recent project is an incubator project, which is a 2-year project where we're working with the University of Adelaide Medical School and the Royal Adelaide Hospital. We have a program that was developed by a non-Indigenous psychologist, Matt Pedler, who you may know, that he's been delivering, and we've reviewed that program from a sort of research perspective, added in some evidence base, some additional evidence base to that, and we are now developing ways in which to deliver that to medical students and to staff within the Royal Adelaide Hospital. They'll enrol in the program, and we will do a pre-post evaluation of sort of knowledge change and understanding to see what impact that program has. And it's a cognitive behavioural therapy informed program.
Okay, nearly there. We also are partnering with the South Australian Genomics Centre. So as I mentioned earlier with the Aboriginal diabetes study, there is some now work being done around kind of looking at the genetics and some of the epigenetics within that work. And so what we're doing is partnering with the South Australian Genomics Centre, and we've employed an Aboriginal person, an early career researcher who has actually done a PhD in genomics. And so what we're doing is we're kind of addressing 4 pillars, one around kind of policy, data, workforce. I can't remember the 4th one, but we're leading a protocol to really inform what genomics research should be considering when engaging with Aboriginal and Torres Strait Islander communities in terms of genomics research. And there's obviously, there's history around, research, health research broadly with Aboriginal and Torres Strait Islander people, particularly also though from a genomics perspective. And so we're just trying to pull in all of the literature as well as insight from our community around what should that look like in South Australia leading into the future when, further genomics work will be done, and we don't want to leave our people behind in that process with precision medicine and all those things. And then, so here we go. Here's the 4 areas. So capacity building, increasing genomics literacy and education, the protocol, and also governance. I should have remembered that because I'm the chair of the governance group. That we've established a South Australian Aboriginal governance group to kind of have oversight of genomics research in South Australia. And then finally, our growth program is really about trying to grow the next generation of Aboriginal and Torres Strait Islander researchers in South Australia. We're also connected to a national Aboriginal and Torres Strait Islander health researcher network called OCA, which brings together about 45 institutions across the country. And so we're working with schools, with STEM projects, with the STEM congresses that happen through the public system, and also through the Aboriginal Science and Training Academy, and have been recently hosting young people who have been really quite interested in genomics and in science, and really trying to build those pipelines for the future so that we have Aboriginal and Torres Strait Islander people in every theme of SAMRI, and working across sciences and health and medical research in the state into the future. So that's just some photos of our young people where they extracted Kwangdong DNA, and then they also did a virtual reality looking at genomics and cells and things like that recently in a virtual reality room, which was a great success, and the young people loved it. So thank you very much for having us.
Kim and Odette, Ananindi, thank you. It's amazing to see what you've achieved together over the last 10 years. And I note that you've continued the way you started, always engaging community. That must be difficult. I think there's 47 different languages in South Australia.
Yes. Yes.
So I take my hat off to you for being able to navigate that space at a statewide level. For us, I guess it's a smaller group in the Riverland Mallee Coorong region, a smaller group of language groups, but still it's important that we have that collaborative approach with the different nations that our work's based on. I was also interested in that acute and primary care interface work that you're doing, and wondering if you were interested in a primary care interface in the country with patients that are admitted to the Royal Adelaide. That certainly would be something that we would be very interested in, and potentially might be able to partner with you, because that's a big issue for our community, I know, is making sure that transition between tertiary care in the city and primary care, whether that's with Murundi or with the AMS that we run in Erewhon country.
Actually,
there's
Paul,
a lot of work to be done.
We started a conversation with Sharon about recently. Odette and I visited Sharon in Murray Bridge, and we talked about this particular project. So I didn't want to preempt anything, but we're certainly in conversations, and we've certainly got you guys in mind. Based on some of the feedback from Sharon, and so we're having some further conversations, and then we'll also go and engage with Murundi, of course, and do our proper due diligence there. But you guys were on our radar as well. Yes.
Look, that's fantastic. I note the time, so we will allow people to get back to their day jobs, but I'm sure you stimulated so many questions and ideas, and congratulations on the way you really are taking a lead in enabling a conversation around genetics and epigenetics for First Nations people that has been really difficult over a long time, and enabling that personalised medicine approach and the benefits of that for everyone. I guess that's what equity is about, isn't it?
That's right.
It makes good sense. So thank you, everybody, for being part of this. Thank you to Associate Professor Kim Morey and Associate Professor Odette Pearson from SAMRI, and Wardliparingga in particular. It's wonderful to hear this great work that's going on just next door to our region, and the work that is having an impact on people who live on country where we serve. So, Anu Ninti and Nakan, thank you, and we'll see you again.
Thank you.